Welcome back. It's still Breakfast Daily, and we're still, on the health segment right now. But we want to say sorry for just cutting off abruptly like that. We just had some technical hitches that we needed to fix, but we're back now. So we're talking about varicocele.
Yes, varicocele.
Varicocele. And joining us in the studio is Dr. Kelvin Owusu, a wellness consultant at Violet Medical Center. And I hear this is, a condition that affects men.
Yes, I mean it is, and you see the way we are struggling to pronounce it, that tells you how little knowledge we have about a varicocele, because it is that common. Up to 20% of men will develop a varicocele at some point in their adult life, and it has it plays a major role in fertility. You see, so it is a big deal, and we need to educate men about it so that we can be looking out for it and avoid the unnecessary complications that it comes along with. So it's a big deal.
Yeah, but in one of the articles I read about it, because I was trying to understand what it was, they said a lot of men have it, like you said, but it goes unnoticed. Why does it go unnoticed?
Well, that's because, like I said, they don't know enough about it. They think it's normal, and some men have had it for so long that they think it's part of their anatomy, so they just go with the flow, you see. And it doesn't help, because depending on how early it starts, the complications are more likely, if it starts early. I don't know if you get what I mean. There's no particular age that is at risk of varicocele. All men at all ages are at risk.
Wow.
Now, if you don't know about it, you don't look for it, or even if you notice something differently because it started when you were a teenager,
you think it's
normal, and then you carry it through until when you are trying to get pregnant. I mean, you and your partner are trying to get pregnant, and it's not happening, and then you go in for a consult with a fertility doctor, and then they do examination and realize, oh, you have a varicocele, And most of the time, what happens is that you actually ask the man, when did this start? And they are like,
they don't even know.
I have no idea. It's always been there.
It's
that
been
kind
there
of
like
thing.
forever, so they think it's a part of.
Exactly, and that can end you up with a lot of complications, because I mean, you know how important childbearing is in this part of the world. So we need to talk about it. We need to educate more people about this condition.
Does it post any symptoms? Does it hurt?
So typically you might notice a dull ache in the affected testes, but it's so dull. It's not something that would immediately call attention to that something is going on. So basically the problem or the issue is that the veins are not able to carry blood away from the testes as it would normally do. So the veins become engorged, just like you see in varicose veins. In fact, that's the name. Varicocele, is what happens in the testes, but the cousin is varicose veins that you notice in the lower limb, the legs, even the abdomen in some people. You see, so when the vein is engorged, it's not able to carry blood away from the testes back to the heart. Then it changes the dynamics, because that the testes are hanging outside the body for a good reason, because the temperature requirements for sperm production is lower than the body's requirements, or that it's lower than the body's temperature. So it hangs that low so that they can have the optimum temperature. But when the blood pools in the veins, that temperature difference is negated, because the blood is warm, so it sort of increases the temperature in that testes, the affected testicle, and that would definitely affect sperm production, which would then go on and affect your fertility. But the bigger challenge is if it starts early or it stays for a long time, it can actually begin to cause atrophy of your testes. Now, atrophy means that the testes will begin to waste away. So you can't actually notice a significant difference in the size between, let's say, the right side and the left side. If the problem is on the left, it can cause the testes to begin to shrink. You see, so that's what atrophy means, shrinking of the testicles. So it's a big deal.
All right. So right now, we talked about varicose veins, and obviously in pregnancy, when varicose veins develop in women, we see it. Do we see it on the testes?
Well, yes, if you're observant, you actually see it. But like I said, depending on how common the knowledge is, then you wouldn't even know what you're even looking at. So typically, yes. So in the image over there, you are seeing the veins a bit more prominent. In fact, the classic description of varicose veins in the testis is like it's like you are carrying a bag of worms. So when you actually hold the scrotum, you feel like there are a lot of tubes inside the scrotum, which is not the same on the other side. So typically, what affects only one side, it hardly affects both of them simultaneously. So when you examine the side which is affected, you might notice that it feels like you are carrying a bag of worms, a bag of plenty tubes in there. So that's the classic presentation. And I mean, as asking. So it gives you that dull pain, that dull pain, and then that feeling of the engorgement. It kind of gets worse when you stand up.
Okay.
Because of gravity acting on it. So when you lie down or in the morning, it's typically not so prominent. But as you get up and you go about your daily activities, it begins to pull more, you know. And so those are the classic symptoms. It's not really something that you'd feel extreme pain that will let you rush to the hospital. So that's why a lot of people would ignore it. And secondly, if it has been there since you can remember, I mean, hey, my testes pains me a couple of times. It's not a big deal. Let me just carry on what I'm doing. So a lot of men ignore it. And generally, men now, they don't like going to hospital.
Yeah.
You know? And so that compounds an already, you know, complex situation. So, I mean, I do encourage men to get themselves checked up, I mean, quite often, so that if there's anything that is out of the ordinary, we can pick it up early and deal with it quickly.
All right, so when it comes to pains, like you said, men in general don't like to go to hospital. Even some women. In fact, people in general don't like to go to hospital these days because everybody like, oh, I can self-treat, Google, and pharmacy and stuff like that. And, you know, when it comes to breast cancer, we are often advised to always check our breasts, you know, after every period and stuff like that. Is it the same thing with with this? Can they also self-test? Can they also try to touch?
Yes, I mean, you can do a self-examination as often as you want to. I mean, it's yours, it's your scrotum. You are bathing, why not just examine it every so often and then see what's happening? You see, because that is one of the ways you can pick changes early. You see, because I mentioned that the size difference.
Exactly.
Now, how are you going to pick the size difference if you are not examining your testes? You know, so let's say and I've had a few patients who are actually quite observant. So they come in, okay, so doctor, I have personally noticed that my scrotum or my testes has become smaller than it used to be. What's going on? And you do an examination. Most of the time it's nothing, it's just something is in their mind. But a few times you might pick that indeed one testicle is much smaller than the other testes. It doesn't mean that the smaller one has a problem. It could just as well be that the bigger one is the one with the problem. But at least once you're examining, and the good thing about the breast, the ear, the nostril, the testicle is that they are paired. So you have something to compare with. You know, so once you check this side, you can check the other side just to you know, for balance, and then you see if there's been a difference. So every man should actually be examining his scrotum every now and then, because there are a lot of things that you might find out about yourself. You see, there might, and I mean, since you're talking about scrotum, there could even be testicular cancer. If you were to touch your testes and you notice a hard nodule hiding in some corner, that's not normal. You need to get it looked at immediately. So as for self-examination, it's very, very much it's encouraged.
I think it's important, the self-examination and the observation as well. Now, I want to find out if there's varicocele. I mean, it's on the testis itself, but with the scrotum sac, there are times you notice that, I mean, it forms up into a hardened sac, and the other times it's so soft, it's just hanging loose. Is there any relationship between that?
It's still part of the body's temperature regulation. You see, if
so that's like a thermometer?
Kind of. You know, a thermostat that kind of regulates the temperature in the scrotum. So if you look at your arms, for instance, on a hot day, your veins come out, they stand out more. You see, because that's how the body, you know, gets off some heat to maintain the core temperature. On a cold day, you hardly find your veins standing out. So in the same way, on a very warm day, your scrotum hangs lower. So that's why there are a lot of folds on the skin of the scrotum to allow for it to hang lower. And then on a cold or chilly day, it retracts, the skin retracts, so that the scrotum, the testes can get some temperature from the body as well. You know, so these are all part of the temperature regulatory mechanisms. You know, but let me also add that in as much as the varicocele may be just an indication of something going on in the scrotum, sometimes it can also give you an indication of something going on in the kidney area, particularly on the left side. You know, because the left testicular vein, this is a bit technical, but the left testicular vein, it drains into the left kidney vein, you know, left renal vein. If there's any tumor that is sitting at that junction, it can cause a back pressure, which will then cause the buildup of blood in the scrotum. So, I mean, if somebody comes in with varicocele, we don't just look at the testes and say go and do surgery. We need to investigate and see if there's anything happening up in the kidney area as well, so that we are sure we've done a good job, because you don't want to go and treat the varicocele, which apparently was because of a tumor, and then miss the tumor, which will then kill the person. You see, so it's important that if you have a varicocele, you don't just treat it as something to do the test, so that you tell yourself that I finished giving birth. So even if there's a varicocele, it can be there. No, it cannot be there. We need to find out what is causing this varicocele. Is it just one of those things? Because indeed, we don't actually know the cause of a varicocele. If we were to take the varicocele by itself, we don't know what causes it. We just know the association. So sometimes there might be a problem with the valves that are supposed to, carry the blood up. Yeah. If those valves have a problem, you will develop a varicocele. But sometimes it could be a tumor, like I said. So don't just ignore it. Get it checked out so that we can deal with it as soon as possible.
All right. So you talked about surgery. Is surgery like the last resort to it, or can you also, get it fixed without surgery?
So when it does. Okay, so here's the thing. Now, first of all, it's not every man with a varicocele that will have problem with fertility. There are a lot of men walking around with varicoceles who have been able to give birth. However, if you are struggling to give birth, if you are struggling to get your partner pregnant, and we discover that it's a varicocele, it could be the cause. So we will have to deal with the varicocele. Now, in that short period, one of the effective things that we need to do would be surgery to try and fix whatever is going on, so that that pooling of blood in the scrotum will be done away with, and then the temperature regulation would be restored, and then maybe the body can resolve whatever problem, and then you start producing quality sperm again, you see. And so having said that, there are other techniques that can be applied. Even though they will not treat the varicocele, they can reduce the severity or the intensity of the discomfort that the man is going through. So one of the common things would be scrotal support, because I did mention that when you actually stand up and you are going around your duties, it builds up some more. So if you can find a way to support the scrotum so that the weight or the action of gravity on the scrotum is not so significant, it will reduce the discomfort. But it will not fix the primary problem. So for a man who actually needs the varicocele to be dealt with for him to have a chance at fertility, that man will most likely have to go through surgery.
Right. Wow. One last thing. Is it visible on the pouch, outside of the pouch, or it's felt within the pouch?
So if you're observant, you can see that there's a fullness in the scrotum. If you're observant, if you have been examining yourself and you look in the mirror, you can tell that there's a fullness that wasn't there before. But then if you go ahead and touch it, then you feel the bag of worms. So you see a lot of, you feel a lot of tubular things in the scrotum that should not be there. Because if you were to examine your scrotum right now, you will not find all of those things. You will, you will feel something, maybe one or two, tubes in there, but not filling the whole scrotal sac.
Wow.
So yeah.
Thank you.
Wow.
Thank you so much. Thank you. That was so much insight on, men's health. And to all the men watching, it's time to buy a mirror. Use your mirrors, use your fingers, use all your senses, because it's actually very important to self-examine and observe what's going on in your body. But Dr. Owusu, where can people reach out to you?
Well, I'm active on social media, so you can find me at Kelvin Owusu MD on all social media channels, and you can also follow my clinic page as well, Violence Medical Center, on all channels.
All right. Thank you so much. All right, so that's all we have for the health segment, and I hope that you took some note, because you need to put them into practice. All right. Anyway, it's time for us to go on a quick break. We'll be right back.